Now, it's been talk of the town, this weight loss aid already being loved by celebrities and referenced to by Jimmy Kimmel at this year's Oscars, and it's been called a game changer.
Yeah, it's an appetite suppressant injection. It's soon to become available through the NHS, with health officials warning that it isn't a quick fix and side effects have to be considered.
Well, let's speak to cosmetic nurse Sarah Cittadino. Good morning to you, Sarah. Hi. Is this a welcome development?
It is. I am, and I have been for the drug actually when it's used appropriately. Now, we are going to see this drug, and we have seen it being misused, overused, abused. And that's the scary thing, right, with any drug that comes to the market, especially in the aesthetics industry, because we know that the industry is so unregulated.
Sarah, have you used it?
Personally, I can't lie, yes, I have used it.
Oh, right, OK.
And
side effects?
Side effects are rotten, I won't lie. So nausea, fatigue, headaches, reflux, constipation,
I think
diarrhea.
I'd rather be fat.
Yeah, yeah, I didn't last very long on it, I must say, because we have to be able to function in the real world, right? I run a business, I have children, and it wasn't something that I could actually facilitate into my life.
What people are talking about with this would be the dose of sort of, what, one injection a month or something like that. Was that the sort of dosage that you were on? Yeah,
so it's one injection a week.
A week? Right, okay.
So there is currently 2 drugs at the moment, and we've got the Ozempic and Saxenda, both licensed for diabetes. Now, one is a daily injection and one is a weekly injection. So what we're going to see come to the market is most likely Wegovy, which is the Ozempic, and that will be once a week injection, right, which is more favourable to inject once a week than once a day. But again, it's a dial-up pen. You have to do it yourself at home. So there is room for medication error. People with needle phobias, they are looking at bringing in an oral form as well. However, yes, it is a needle.
But this is going to be prescription only, and it could be a game changer for those people who have a BMI over 30 and just cannot shed the weight.
Absolutely. This is what we look at as healthcare practitioners, right? You know, our biggest crisis at the moment is obesity. You look at cardiovascular disease, you look at stroke, diabetes. People that suffer with weight gain and really cannot remove this weight, it's going to be a game changer. It's going to be a lease on life for them and an option. And as long as it's well controlled, you have got the right practitioner that's doing the right follow-ups, the right pathology, making sure that all your hormones are intact, then actually the drug will have a really nice outcome.
This has been developed, people realise this works because people with diabetes have been using it up until now with positive effects. I mean, I did ask you for the side effects there, so that is a difficult one for people to deal with. But if it reduces your weight, and it has been proven to do so.
Exactly. Right? And it's always benefit versus risk. And I always look up with the patient, if that patient is going to benefit from this drug, their quality of life, ongoing health issues, comorbidities, if these things are going to be improved, then absolutely this drug should be available.
But the side effects that you describe were generally discomfort. Are there any more serious ones that, you know, could actually have a health negative connotations?
So long-term use, it hasn't been used for weight loss long-term, so we are unsure of that at the moment. There is a boxed warning of thyroid medullary cancer. Now, this is quite alarming. It hasn't been proven in humans. It has been proven in rodents. So it is a boxed warning. You do have to take that into consideration. Anyone with an existing illness like that would obviously not be able to take the drug. Pregnancy breastfeeding would prevent someone from taking it. Anyone with kidney issues, or any ongoing forms of issues like medical.
But Sarah, what are they saying in terms of percentage weight loss?
So it's really subjective. So I've seen different studies, and personally from prescribing it and also having it, we generally were seeing around about 5 pounds a week. We did see up to a stone in 4 weeks of weight loss. It is rapid.
And as a cosmetic nurse, you would be qualified to prescribe this drug?
Absolutely.
OK, so it doesn't have to be a doctor?
Well, I'm a prescribing nurse, so if you're you have to be able to prescribe a drug, and off the basis of that, this has to be within your scope of practice. Right. So you have to understand the drug, the side effects, and be able to competently give that to a patient.
So we're talking about this being dispensed on the NHS. If you wanted to go privately and pay for this, what would one of these injections cost, or a course of these injections cost?
So this is really alarming, guys, because we actually prescribe this drug at £499 for a 6-week course. Now, it's now available online at £160 and £99 on online pharmacies in an unlicensed capacity. Now, whether that comes to the NHS and it's actually free for the right patient, or if you're paying it private, it could vary. There is going to be no cap on this drug. So therefore, this is quite alarming because the access to this drug, you can get it extremely cheap, but I'd be very worried about that, because what kind of support are you going to be getting if you're going to be getting it online? Is someone going to be running blood profile of you? Are they going to be making sure you are losing weight, but appropriately? And what happens once you've lost the weight?
Yeah. And also we know all those people with eating disorders that could potentially abuse it if they're able to get their hands on it for cheap. But we're out of time, Sarah. So absolutely fascinating. Thank you very much for telling us all about it.
So the good news is you can get it, you can prescribe it. It costs anything from £200 to £500. You will probably lose a stone in a month, but it's very probable you will have constipation, you will have nausea. You'll feel pretty rough. You'll not feel like looking at food.
I mean, you'll look fabulous, but you might not feel it.
OK, we have to leave it there. Thank you very much.